Hello, my name is Genevieve Fontaine. I'm the Equine Extension Veterinarian at the College of Veterinary Medicine of the University of Florida, and my background is in internal medicine. So today I'm going to address the topic of equine medicine. The way I decided to cover this topic is to go over a normal physical examination of a horse and try to detect the most common abnormalities that will be observed during a physical examination. And in relation to that, I'm going to address some of the most common diseases that are commonly associated with these clinical signs. I will also cover an overview of the diagnosis and the treatment of some of these diseases. First of all, when you start a physical examination of a horse, you always try to take a few steps back. And from a distance, the parameters that you will look at will be the attitude of the horse, the posture, the body condition, symmetry of the body, and the integument. First of all, most horses that will come with a change in attitude will exhibit a depressed attitude, and this can be caused by a variety of things. Pain will be one of the most common causes of a depressed attitude, also overall weakness, and in some cases we'll also observe cerebral dysfunction. On this particular slide, you see a little foal that was about 4 days old when he was presented, and he was presented to us with a very severely depressed attitude, which was, as we found out, caused by the presence of an intestinal intussusception. So severe pain would cause this foal to exhibit this attitude. Abnormal behavior most commonly is the result of cerebral dysfunction. And in adult horses, one of the very common causes of cerebral dysfunction will be hepatoencephalopathy, and this is caused by severe liver dysfunction. Hepatoencephalopathy is related to cerebral dysfunction through a variety of mechanisms. At least people think that hypoglycemia may play a role, also hyperammonemia, and a theory that seems to be the most commonly accepted is a decreased ratio between the branched chain amino acids and the aromatic amino acids in the blood. This condition will be diagnosed through serology and increased hepatic enzymes, and also in some cases gross changes in the liver will be observed by transabdominal ultrasound. Also, liver biopsy can be very helpful in diagnosing this disease. The treatment is mainly supportive. As you know, most of the time when horses exhibit signs of, or animals in general, exhibit signs of liver dysfunction, about 2/3 or 3/4 of the liver is affected and non-functioning. Therefore, the treatment is mainly palliative, and there's obviously no possibility to do liver transplants in large animal. So some of the treatments that are recommended are to change the diet and try to decrease the workload of the liver by adjusting the level of protein in the diet. So therefore you want to give a diet that is poor in protein, high in energy, and the way to achieve that will be to feed corn, molasses, and beet pulp. Also, antibiotics and steroids are commonly recommended to treat this disease. And if the liver dysfunction is found to be caused by toxic, removing the toxic may help to increase the liver function. Another common cause of cerebral dysfunction will be viral encephalitides. And the most common viruses that affect the brain of horses are alpha viruses that include Eastern equine encephalitis virus, Western equine encephalitis virus, and Venezuelan. Another virus that has recently come out in this country is West Nile virus, which is a flavivirus. And of course, rabies remains a possible differential for any brain dysfunction that shouldn't be forgotten. The alpha viruses, the Eastern, Western, and Venezuelan encephalitis viruses, will have a varied distribution throughout the country. Eastern, as the name indicates, is most commonly observed on the east part of the country, and in the southeast we see a lot of these cases throughout the year. These viruses are transmitted to horses through the bite of infected mosquitoes, and the normal cycle of these viruses involve a mosquito and a bird, and horses and humans, for that matter, are incidental or accidental hosts for these diseases. Except for Venezuelan encephalitis, these diseases cannot be transmitted from horses to continue the cycle to through the bite of a mosquito. They cannot be transmitted laterally between horses or from a horse to a person. Rabies, on the other hand, can potentially be transmitted to humans, but there's very few reports of human infection with rabies from the contact with an infected horse. As a matter of fact, the last reports goes back to the beginning of this century. Other potential causes of brain dysfunction will be any brain lesion that can be caused by trauma as a consequence to lightning strike, or as a consequence of the presence of a brain abscess or a brain tumor. Another very common change in attitude in horses will be signs of what is called colic. And colic is really refers to any sign of abdominal pain. And most of the time, this abdominal pain will be associated with gastrointestinal problems, but very commonly also we'll see cases of pleural pneumonia or other abdominal events that will cause horses to colic. And the most common sign that we see in horses that colic is pawing, stretching, laying down, or in some cases they can be very violent and try to throw themselves on the walls in the stalls and roll excessively. So these signs all are related in most cases with gastrointestinal problems. As you see on this slide, surgery that was performed to extract an enterolith that was blocking the passage of feed material within the small colon. The posture of horses can also tell you a lot, give you a lot of information about some underlying diseases. Changes in the posture can be caused by musculoskeletal problems, and a very common musculoskeletal problem observed in horses is laminitis. And laminitis is truly caused by the inflammation of the digital laminae, which is the tissue that is present, that connects the bone, the third phalanx, to the horn of the hoof capsule. And this tissue can become inflamed relatively easily in association with diseases that include an inflammatory component, such as a colitis, metritis, or pleural pneumonia. Very often, laminitis will be the consequence of a severe colitis, and we'll cover that in the intestinal part. So what happens is the inflammation causes severe vascular disturbances within the blood vessels of the laminae, and these disturbances can cause an ischemic necrosis of the laminae, which in turn causes breakdown of these laminae. And the horse's weight is really transferred to all four feet through the laminae. So therefore, if there is a breakdown, the bony column is pushed down within the hoof capsule, and what we'll see from the outside is horses that start to exhibit a lot of pain, first of all, because they have to stand on very inflamed structures. And also we can see sometimes the evidence of this shift of the bony column within the hoof capsule by looking at the coronary band, which is the junction between the hoof capsule and the hair of the pastern region, where if we see an indentation, it means that the bony column is actually pushed down within the hoof capsule. Also, in some cases, the solar surface, so the underside of the hoof capsule, can become more prominent due to the bulge caused by the bony column pushing on the solar surface. All in all, this condition is extremely painful for horses, and very often the front feet are affected more so than the back feet. And most of the weight of horses, about 70% of the weight, is carried by the front feet because of the long and heavy neck and head that they carry. So therefore, horses that have severe pain in their front feet will try to report their weight on their back feet. As you see in this picture, this horse has his hind feet tucked underneath himself to try to report the weight on his back feet and try to alleviate the pain caused by the excessive weight on the laminitic feet. The diagnosis of this condition involves physical examination. This posture and the gait associated with it are fairly typical and very easily recognized. But in order to assess the degree of changes in angulation of the pedal bone within the hoof capsule, radiographs are really the way to go in order to assess the prognosis also, because various angles will be associated with various prognoses. Also, as far as laminitis is concerned, two different syndromes are recognized. Acute laminitis, which is associated with a recent event in an inflammatory condition, and chronic laminitis. And horses with chronic laminitis are actually in the healing phase of an acute laminitis. And since hoof growth takes a long time, the hoof grows about 1 centimeter per month, it takes a long time for these horses to recover completely, during which they can experience several bouts of acute laminitis and therefore cause the changes within the hoof conformation. Changes in the posture can also be caused by neurologic disease, and in particular diseases that affect the spinal cord and causes dysfunction. The most common diseases that we see in horses that affect the spinal cord include equine protozoal myeloencephalitis, or EPM, and cervical vertebral malformation, which is also referred to as Wobbler's syndrome. The first disease, the EPM, is caused by a protozoan parasite, which is called Sarcocystis neurona or Sarcocystis falcatula, which cycles between opossums and birds. And horses, once again, are dead-end hosts and accidental hosts for this disease. The parasite has a tendency to lodge itself within the spinal cord and cause lesions that will in turn result in proprioceptive deficits. And as you see, this horse on this picture has no idea where his feet are in space. And if you start walking this horse, he's most likely going to look very wobbly and maybe will be hypermetric or have signs of circumduction if you spin him around. So these postures can be fairly characteristic of spinal cord dysfunction. The cervical vertebral malformation will be most commonly observed in young horses that experience a fast growth or are on a high plane of nutrition. The ways that we have to diagnose these two diseases is, for EPM, we look for the presence of antibodies to Sarcocystis neurona in the cerebrospinal fluid. And the reason why the cerebrospinal fluid needs to be checked for that and not the blood is that most horses in this country have been exposed to this parasite at some point in their life and will test positive in the blood for EPM. Therefore, you need to look at specifically what happens around the spinal cord, where these antibodies have no reason to be except if the parasite is present. In the case of cervical vertebral malformation, this is a diagnosis that is achieved by radiography of the cervical vertebral column, and the changes that are seen are proliferative changes, and sometimes we can also assess the presence of instability. And this is more commonly diagnosed with a myelogram, where we inject a contrast dye within the intrathecal space, and this dye will identify areas of compression of the spinal cord that can be enhanced by flexing or extending the vertebral column. So this disease is most likely congenital, but we do see the clinical signs of it when the horses generally reach a year and a half of age and then start working, and when most of the time the clinical signs become obvious when horses are used for their normal athletic purpose. Treatments for the cervical vertebral malformation include restriction in the diet, and this conservative treatment can be successful in some of the mild cases. Some people recommend also to do a surgical procedure to try to stabilize the different vertebrae that are involved, but this is a very involved surgery and should be considered very carefully. Treatment for EPM involves use of anti-protozoal medications. Other postures, changes in posture can be caused by neuromuscular diseases, and some of the most common neuromuscular diseases caused in horses are tetanus and botulism. Tetanus is caused by the presence of Clostridium tetani that releases a toxin that will locate itself at the neuromuscular junction. And the extensor muscles seem to be affected more so than any other group of muscles within the body, which results in this sawhorse stance where the horses have a very rigid appearance. They are also very commonly hyperreactive, in particular to noise. And one of the common clinical signs also for this disease is the prolapse of the third eyelid that seems to cover about half of the cornea, in particular in response to noise. And the ears are usually straight back and very rigid as well. Most of the time there will be a history of a wound, but since Clostridium tetani is strict anaerobic bacterium, the wound very often will be a puncture wound, so it will not always be noticed. The vaccination status is really important to know in this disease in order to diagnose it positively, because the tetanus toxoid, which is used to vaccinate horses against tetanus, is used in most horses in this country, and therefore tetanus has become a very rare disease. But this vaccine is fairly effective. Therefore, if the horse has a history of proper vaccination, it is unlikely to have tetanus. Botulism is seen in some parts of the country, in the Northeast in particular, where forage poisoning may be more common. Toxico-infectious botulism is seen more often in foals, where forage poisoning will be seen more often in adults. This is a disease that also affects the neuromuscular junction, where the toxin released by the Clostridium botulinum will prevent the release of acetylcholine in the neuromuscular junction and therefore result in the flaccid paralysis. Adults very often start showing clinical signs in the face, and these clinical signs may be exhibited as dysphagia, where horses start spilling their feed and become unable to drink. In foals, however, we see a different syndrome where these foals tend to lay down more often than they're supposed to. They may fall and shake and tremble, and this is therefore referred to as shaker foal syndrome. There is truly very little treatment for these two diseases, and they're pretty severe diseases that may lead ultimately to the horse's death. Tetanus can be treated with intrathecal injection of tetanus antitoxin or high doses of systemically administered tetanus antitoxin, but very often once the clinical signs are observed, these horses are in trouble. Supportive care is also very important in these two diseases. Forage poisoning caused by Clostridium botulinum does not really have a good prognosis at all. Supportive care can be attempted, and in case the horse has recently been in contact with silage containing the preformed toxin, it may be useful to administer mineral oil to try to prevent further absorption of the toxin. In the case of toxico-infectious disease in foals, the disease is caused by the proliferation of Clostridium botulinum within the intestinal tract of the foals. So therefore, it is an ongoing process. The prognosis, however, with aggressive supportive care in foals can be a little bit better. It may involve ventilatory support to some extent because the respiratory muscles may become paralyzed. So it has to be, the fall has to be worth this type of treatment, because this can be going on for several weeks and does not always result in a positive outcome. Another parameter that you try to assess looking at a horse from a distance is body condition. So the most common problem that we see with body condition will be a weight loss or a failure to thrive, and the most common condition that leads to that is malnutrition. Teeth problems can also be involved, parasites, chronic infection, or neoplasia. When we look at a horse that is losing weight or is hard to keep weight on because of teeth problems, very often we're looking at an older horse. And the reason why teeth problems may become prominent in some horses is because horses are truly not designed to eat a few meals of grain a day. They're designed to be grazing about 8 hours a day, which causes their jaws to have a rotary movement that will spontaneously grind their teeth. Teeth growth in horses is continuous. Therefore, if there's not a proper alignment of the jaws, or if the jaws are not used like they should in natural conditions, teeth problems may erupt as points. And another factor that may be involved is the fact that is the conformation of the dental arcades. The upper arcade is wider than the lower arcade in horses. Therefore, it's not uncommon to see points develop on the outside of the upper arcade or on the inside of the lower arcade. And this can be prevented by regular dental care. In most horses, it is recommended to have their teeth looked at or treated and floated about twice a year, once a year at least, but twice a year is probably a better bet. If you do have a problem with teeth that are missing and not preventing the growth of the opposite tooth, then you probably should have those horses looked at more commonly, more often, up to 4 times a year. Weight loss or failure to thrive may also be caused by parasites, and parasite problems are more commonly observed in young animals that have not developed their immunity to those parasites yet. In foals, some of the most common parasites are ascarids, and these parasites may cause chronic diarrhea, poor appearance, a rough hair coat, and in some cases colic. If they become abundant enough, they can actually obstruct the intestinal tract. In particular, if a horse that has not been regularly dewormed is treated and you have a sudden death of large numbers of parasites, these parasites can actually accumulate within the lumen of the intestinal tract and completely obstruct the intestinal tract. So ascarids are pictured on this slide in a young foal that ended up dying of a very severe enteritis. In adult horses, we do not very commonly see problems associated with ascarids because they have become immune to it. However, small strongyles seem to be a parasite, type of parasites that causes most problems in the adults. And the reason why they're associated with failure to thrive is that they insist within the lumen, within the intestinal wall. And if the infestation is severe enough, this encystment can actually cover a large enough surface of the intestinal tract, which prevents the absorption of nutrients. And these conditions can be diagnosed by fecal floats and looking for parasite eggs. Also with a response to treatment, which is commonly done with antiparasitic drugs. Most horses currently have a pretty good preventive program, but in some conditions where horses have a lesser immune system or a less strong immune system, you may observe problems associated with parasitism. Chronic infection may also be associated with failure to thrive, and some of the signs of chronic infections that we see in horses are related to the presence of abdominal abscesses, This can also be associated with recurrent fever and horses that will colic occasionally, or colic all of a sudden if this abscess involves a large enough portion of the intestinal tract. Some of the most common bacteria that we see associated with these abdominal abscesses are Rhodococcus equi, mostly in young horses, or strangles, which is associated with Streptococcus equi, var equi. These two bacteria will be addressed in the respiratory portion of this talk. And finally, neoplasia can possibly be involved in loss of condition in horses. And as you see here, a pretty extensive carcinoma of the liver was causing this horse to be presented for chronic weight loss. Lymphosarcoma, however, is the most common neoplastic condition observed in adult horses. And there's a variety of types of lymphosarcoma: cutaneous, multicentric, mediastinal, or intestinal lympho. And this disease is most commonly observed in middle-aged horses, so it's not necessarily an old animal disease. Other diseases that may cause a horse to lose weight chronically is liver disease, renal disease, or heart failure. Another parameter to be observed when you look at a horse from a distance is symmetry. And it's really important to observe horses very carefully, because sometimes these signs of asymmetry can be fairly subtle, unlike on this picture where this horse shows the complete absence of quadriceps muscles, which was also associated with an abnormal gait, which actually was the reason why this horse was presented. So muscle atrophy can be caused by disuse or by chronic pain. In other cases, the atrophy can be neurogenic in origin, where the nerve conduction is prevented to the muscles. So this is fairly commonly observed in cases of EPM or after trauma. Integument. The skin can tell you a lot about what's going on as far as systemic disease. And one of the very common signs that we see in older horses are hirsutism. And this is a condition that leads horses to poorly shed and to have a very long and curly hair coat that persists throughout the year. This condition, as I said, is very common in older horses and is caused by the presence of a benign tumor within the pituitary gland, which is a pituitary adenoma. And this tumor results in abnormal levels of POMC, proopiomelanocortin, which is a precursor of ACTH, and therefore the regulation of the cortisol levels in the horse are disturbed. These horses will very often exhibit polyuria and polydipsia, so they will drink more often than you expect and urinate more often than you expect. Chronic laminitis is also a fairly common finding in these horses and is potentially associated with high levels of cortisol, circulating cortisol, or loss of the regulation of the diurnal cycle of cortisol. These horses, due to the fact that they have high levels of circulating steroids, are predisposed to recurrent infections. Skin diseases. I'm going to cover the most common skin diseases briefly that you will observe in horses. First of all, habronemiasis. This is a disease that is observed very commonly in horses in the summer, and it is due to the presence of parasite larvae that will affect very commonly the canthus of the eye, medial canthus of the eye, or the conjunctival sac that actually results in those suppurative ulcerative lesions. They can sometimes be pruritic as well. Other common areas where you'll find these lesions will be the prepuce, the ventrum, and the legs. And these lesions will be caused by the introduction of those larvae when flies feed on wounds, for instance. So therefore, it's really important to keep wounds clean and covered at all times. The adult parasite lives in the horse's stomach and releases eggs and larvae that are then picked up by fly larvae, and therefore the cycle continues through flies. Sarcoids are the most common skin tumors in horses. They are a benign tumor, but they can potentially be locally invasive, and there's various forms of sarcoids. Verrucous, which is kind of like a wart, which is pictured in this slide here. Sometimes sarcoids can form subcutaneous nodules, or can form just an alopecia lesion, which is very localized. These tumors can be diagnosed by biopsy, skin biopsy, and sometimes a presumptive diagnosis is just made based on the appearance of the tumor. And they can be treated with cryosurgery or intralesional injection of chemotherapeutics. Squamous cell carcinoma is very commonly observed in horses with light skin that are exposed to a lot of UV light. So this is something that we see a lot in the southern states, where in particular paint horses or albino type horses with a very light complexion will be commonly turned out at all times and exposed to a lot of sunlight. So this is a tumor that can potentially metastasize, but most of the time it is invasive locally, and in very in most occasions it doesn't respond to treatment very well if it's taken late in the course of the disease. So any small lesion that looks like squamous cell carcinoma can be positively identified through skin biopsy, but these lesions should be treated aggressively early on. And once again, intralesional injection of chemotherapeutic agents such as cisplatin can be useful. As far as nodular lesions, melanomas are very common in older gray horses, and one of the most common sites of melanomas will be the perineum. Sometimes lesions can also be observed on the face, at the base of the ear, on the neck, and these lesions are usually not preventing any activity for the horse. They tend to grow very slowly unless there's an attempt to remove them, where they can spread then more aggressively. There's one form of melanoma which is more aggressive and is more generalized, but it is not very common. So as far as diagnosing these lesions, just the appearance and the presence of lesions of that type in older gray horse. And as far as treatment, it is recommended not to treat them at all. Nodular granulomas, these lesions are commonly observed on the neck and under the saddle. The reason why they occur is not absolutely clear. They can be consecutive to insect bites, and they're usually just an accumulation of inflammatory cells in the subcutaneous tissue. And the treatment for it will be intralesional administration of corticosteroids or excision in the cases where they're poorly responsive. Alopecia can be caused by cheilicoides hypersensitivity. This is a condition that occurs every summer in some horses and is therefore called summer itch. It is a highly pruritic type of lesion. It usually affects the mane and the dorsum and the tail head, to the point where horses can scratch themselves to the point where they lose every single hair on those areas, and it usually tends to become worse and worse year after year. The best way to try to prevent this from happening is to remove the cause, which is a cheilicoides insect, and it is actually a type of allergic response to the saliva of some insects such as gnats. So recommendations are to stall horses at dusk and dawn when these insects are the most active, And in some cases where the pruritus becomes extreme, it is sometimes recommended to treat these horses with corticosteroids. Dermatophilosis is caused by a bacterium named Dermatophilus congolensis, and this is a type of lesion that is usually non-pruritic but may become pruritic. It's alopecic, and it's commonly observed in horses that are housed outside and exposed to a lot of moisture. Horses with decreased immune responses or decreased immunity will be more susceptible to this disease. The treatment for the disease will be to remove horses from this moist environment and to apply topical disinfectants such as betadine. Dermatophytosis will be caused by fungi of the species Microsporum or Trichophyton, and these diseases are very commonly observed in young horses that have in some cases a decreased immunity. Overcrowding, housing in poor, dirty conditions, and moisture, excessive moisture, will be factors that are commonly reported in the history. And in some cases, just removing the conditions and treating the horses in areas that have enough light, have less humidity, will help to cure this disease. Also, topical administration of antifungal agents or disinfectants such as betadine, once again, can help, and these horses will generally recover within a few weeks. Now we're going to continue the examination of horses by regions in their anatomy and look at every part of their body specifically to detect abnormalities and diseases commonly associated with these abnormal clinical signs. First of all, we're going to start with the head and neck. When you look at a horse's head, it's really important to assess the symmetry of the face. And the asymmetry can affect various parts of the face, including the sinuses. And sinusitis is a fairly common disease observed in horses. Usually this disease affects older horses, and it is associated with an infection of a tooth root because the molar teeth roots actually are located within the sinuses of horses, and therefore any infection at the base of the tooth can result in a generalized infection of the sinuses. The maxillary sinuses are the ones that are most commonly affected. This type of lesion can be detected on head radiographs, and the initial problem should be addressed, which means sometimes to remove the tooth. In young horses, we sometimes observe the presence of sinus cysts, which result in a severe deformation of the face, such as in this picture. And this is a non-infectious disease. It's just a hyperproduction of fluid by the lining of the sinuses, and an obstruction to the evacuation of this liquid. So therefore, the treatment for this condition is surgical, where the sinus is open and the lining of the cyst is resected. When you look at the head, it's also important to perform a careful examination of the cranial nerves, and some of the most common defects that we will notice will involve the cranial nerves 7 and 8. So the facial paralysis is a disturbance of the function of the facial nerve, which is cranial nerve 7, and the signs associated with it will be a drooped ear, eyelid, and a deviated muscle away from the site of the lesion. This disease can be caused by anything that affects this nerve, really, and that's the equine protozoal myeloencephalitis that I mentioned before, that can also cause ataxia and abnormal gaits, may affect the root of the cranial nerve 7 and result in this presentation. Trauma can also become a factor, in particular if the lower part of the nerve is affected, where horses that lay down on their side during anesthesia, for instance, and have a compression of the superficial tract of the nerve, can end up with a deviated muscle, and this is usually transient. Another nerve commonly affected is the cranial nerve 8, and this is a vestibulocochlear nerve, and this may result in the vestibular syndrome. This syndrome is associated with a head tilt, nystagmus, and in some cases, this syndrome can be caused by a fracture of the petrous temporal bone, which then results in bony proliferation when this fracture heals, that will in turn compress the nerves. And in many cases, cranial nerves 7 and 8 will be affected equally. So it's not uncommon to see this syndrome associated with the drooped ear and eyelid that we saw previously. This condition is associated, as I said, with a bony proliferation of the temporohyoid bone, and it's called temporohyoid osteoarthropathy. This is diagnosed by either radiographs or endoscopy of the guttural pouches, where the stylohyoid bone can be enlarged and visibly enlarged by endoscopy. The other condition that may result in this problem is chronic otitis media. Looking at the eyes is also very important. Eye problems are not that uncommon in horses. Therefore, once again, we're going to look at the symmetry, and the size of the eyes can be reflective of problems such as glaucoma, like on the upper part of the slide, or phthisis, which is a reduction in the size of the eye. And this is very commonly observed in horses after trauma, and the eyeball is actually deflated, or after severe chronic conditions such as uveitis that we'll cover here in a minute. Ocular discharge, especially if it's unilateral, should be addressed, and very commonly it comes from the obstruction of the nasolacrimal duct, which in turn prevents the evacuation of tears, and this can be corrected very easily by flushing the nasolacrimal ducts. Horses, with the size of their eyes and the lateral position of their eyes, are very prone to trauma, and corneal ulcers are very common in horses. They need to be addressed adequately and rapidly because they can very commonly become infected and lead to chronic problems in the eye or loss of the vision. In particular, down south, we seem to have a problem with fungal infection of corneal ulcers, and this needs to be addressed within hours after it's noticed. So the diagnosis of a corneal ulcer will be by the application of fluorescein dye on the corneal surface, which will identify areas of corneal defects, such as in this picture. On the lower picture, you see a corneal ulcer that has been going on for a while already because of the presence of blood vessels coming from the sclera that will invade the cornea in order to perform the healing of this ulcer. Another common ocular disease in horses is recurrent uveitis, and this is an idiopathic disease which is thought to be associated with the presence of antibodies to leptospira. In any way, this disease is characterized by a very marked photophobia. Horses are afraid of light, and epiphora, where there's an excess production of tears. This condition is characterized by flare-ups of severe inflammation of the eye and can eventually lead to blindness. Another important thing to look at when you look at the face is the nose. First of all, the size of the nostrils needs to be even, and these nostrils need to be moving evenly. The airflow also needs to be addressed, and you need to check the volume of airflow and make sure that it's coming the same way from both nostrils. You can also check the odor for the presence of any kind of necrotic lesion or infection, and the noise for the presence of anything that could affect the turbulence of this flow. Nasal discharge is a common problem observed in horses, and the discharge needs to be characterized as the in unilateral versus bilateral. And then the type of discharge, also whether you're dealing with mucus, pus, blood, or food, will be reflective of different types of affections. In general, we consider that a unilateral discharge will come from anywhere from the nostril to the throat. And this can be affected when nasal passages are affected, or the ethmoid region, or the guttural pouches, which are structures located at the back of the throat, and as we'll see a little bit further down, can be affected by various diseases. The discharge may become bilateral if you're looking at a disease of the guttural pouches that is very productive, either with pus or blood, and in some cases the discharge will be bilateral if the lower respiratory tract is affected, whether you look at the trachea or the lungs. So any lower respiratory tract disease will most likely result in a bilateral discharge, whereas any upper respiratory tract disease will most likely result in a unilateral discharge, so coming from one nostril. When you look at the discharge, if you're dealing with a serous or mucus bilateral discharge that is not too abundant, you may be dealing with a viral infection. And some of the most common viruses that affect the respiratory tract of horses are influenza or equine herpes virus 4. In some cases, allergies of the lower respiratory tract, such as chronic obstructive pulmonary disease, may result in a bilateral serous discharge, or sometimes mucoid discharge as well. If you're dealing with a purulent unilateral discharge, you need to be thinking about sinusitis. So once again, this is a very common disease in older horses that is caused by the presence of an infection at the tooth root. Or you may also be dealing with a guttural pouch infection. And one of the most common organisms that cause infections within the guttural pouches is strangles, or the strep equi var equi. A purulent bilateral discharge is most commonly associated with pneumonia. In adult horses, we see a type of pneumonia that is caused by a mixed population of bacteria. And this is a fairly common event after long-distance shipping, where horses are exposed to a combination of factors. First of all, they have their head tied up, so they can't really get rid of a lot of the allergens or particles that they inhale, like they would if they could blow their head down, blow their nose in a sense. Another factor is dehydration that prevents the mucociliary apparatus from functioning properly and getting rid of those particles once again. Another factor will be stress associated with long-distance shipping, especially in young horses that have not been shipped a lot in their life. And therefore, horses are exposed to a variety of bacterial particles or bacterial organisms that will colonize their lower respiratory tract. And this is a disease that is truly life-threatening. Generally, we see a lot of abscesses within the lungs, and generally it's associated with the severe pleuritis, and these horses are extremely sick, and very commonly the prognosis is very poor. In foals, the most common cause of bacterial pneumonia is Rhodococcus equi, which is an organism that tends to form microabscesses throughout the lung. This is a disease that can be diagnosed by transtracheal wash and radiographs of the chest. In older horses with pleuropneumonia, thoracic radiographs are not always very feasible because of the size of the chest, and we more commonly use ultrasound to diagnose these diseases. And then to characterize the organisms that are causing this pleuropneumonia, a transtracheal wash is generally the routine, with a subsequent culture of the fluid retrieved. When you deal with sanguinous or blood discharge from the nose that is unilateral, you need to think about trauma. You need to think about ethmoid hematoma, which can also be caused by trauma, very commonly associated with passage of a nasogastric tube, or guttural pouch mycosis. And in that case, the mycosis will affect the internal carotid artery, which can result in a very significant hemorrhage that can turn into a bilateral discharge. And this is a life-threatening event because of the size of this artery, and horses can easily bleed out consecutively to this disease. If the blood is coming bilaterally and you're dealing with a racehorse that shows this discharge after exercise, you may be dealing with exercise-induced pulmonary hemorrhage, and the specific etiology is not clear for this disease. People think that it may be related to an increased pressure within the capillaries of the lungs and subsequent leakage of these capillaries within the alveoli that therefore come out as a bilateral sanguineous discharge. When you see feed material coming out of the nostrils, there's three main differentials that you need to be thinking of. First one is an esophageal obstruction, in which case the food will come out of both nostrils. And this is commonly associated with the ingestion of pelleted food and a blockage of the esophagus. This is diagnosed by trying to pass a nasogastric tube in the horse, and most commonly this nasogastric tube will not pass the obstruction. Gastric reflux can sometimes result in a bilateral alimentary discharge, and this is associated with a colic that prevents the stomach from emptying and causes horses to empty their stomach either by refluxing spontaneously, but in most cases this is prevented by the length of the soft palate in horses, and therefore the pressure can become such that the stomach will actually rupture. Another cause of bilateral alimentary discharge will be dysphagia caused by cranial nerve dysfunction. Another part of the head that is important to examine is the mouth. And the mucous membranes in horses are a very good indication of systemic disease. Some of the findings regarding the mucous membranes will be pale membranes, and this will be associated very often with anemia. Anemia can be caused by chronic disease, very often chronic infectious diseases in horses. It can also be associated with GI parasitism, which is in some cases associated with leakage of the blood vessels or just consumption of the red blood cells. Blood loss, chronic blood loss most of the time, will result in anemia. In case of an acute blood loss, the anemia may be more profound and associated with rapid degradation of the general status of the horse. In some cases, we will be faced with immune-mediated anemia, but this will be a less common disease in horses. And equine infectious anemia, which, as the name indicates, is infectious and is related to a virus. This disease is a very important disease to try to track down because it is reportable. Horses are supposed to be traveling with a negative Coggins test everywhere they go. In any places where they participate to events such as shows or races, and so this Coggins test will test for the presence of this virus and will be necessary for any transport or any event where the horse participates. Horses that are found to be positive for equine infectious anemia either need to be destroyed or isolated for the rest of their lives because they become lifelong carriers of this virus, and they will need to be isolated within a distance of other horses that will prevent transmission of the virus by blood sucking insects from horse to horse. Injected membranes may be reflective of endotoxemia. And endotoxemia will occur in horses with any disease related with the presence of gram-negative bacteria. And these bacteria may break down and release lipopolysaccharides from the cell walls that will in turn act as an endogenous toxin for horses and cause all sorts of disturbances, including vascular disturbances that will result in those injected membranes. Endotoxemia is very commonly associated with colic, and the presence of these gram-negative bacteria in the intestinal tract is normal. What is not normal is the reabsorption of the endotoxins from the intestinal tract, which may be due to the fact that in some cases of colic, the intestinal barrier is not competent anymore, and these endotoxins are reabsorbed and have access to the general circulation of horses. In cases of severe pneumonia, we can also have growth of gram-negative bacteria and release of endotoxins. And in mares that have retained placenta and subsequent metritis after foaling, this is also a very common complication. We have seen earlier that laminitis could be the consequence of any of these diseases. There seems to be an association between endotoxemia and laminitis, but the exact pathogenesis is not clear at this stage. Membranes can also become icteric, and the most common cause of icterus in adult horses will be anorexia. And you just need to have a horse that hasn't eaten for 2 or 3 days to start seeing signs of icterus. This is due to the fact that the bilirubin is increasing in circulation. Once the horses return to a normal feeding pattern, this resolves within a few days. Icterus can also obviously be associated with liver disease, and the most common liver diseases in horses include serum hepatitis, which can be caused by the use of tetanus antitoxin, which is a product prepared out of horse's serum. So this could be a complication of treatment with tetanus antitoxin. Another common cause of liver disease will be perlizidine alkaloid toxicosis, and perlizidine alkaloids will be found in certain toxic plants, and the chronic ingestion of these plants can lead to hepatocellular necrosis and enough liver damage that will in turn result in liver failure. Cholelithiasis, or stones within the liver, can also occur in horses. It's not that common of a disease, though. The most useful diagnostic test to assess the presence of liver stones will be ultrasound. Liver disease in general will be diagnosed through the help of serology and the concentration of liver enzymes circulating in the body, liver biopsy, or liver ultrasound. Looking at the rest of the head, this is also where you're going to address lymph node enlargement. In young horses, lymph nodes, whether you look at the intermandibular lymph nodes or lymph nodes located in the throat lice, the retropharyngeal lymph nodes, these lymph nodes may be enlarged due to the fact that horses come across their first pathogens between the age of 0 and 2. And this is just a normal sign of the immune system responding to these pathogens. So just a slightly enlarged set of lymph nodes in young horses, nothing to worry about. However, if you have a significant enlargement of these lymph nodes and they become sensitive to palpation, you have to worry about the presence of abscesses, and one of the most common cause of abscessation of lymph nodes in this area of the horse's body, again, will be strangles. And the bacterium, once again, is Streptococcus equi, which is a very contagious disease, and in general, once you have one case in the barn, the disease goes through the barn. This is diagnosed by isolation of the bacterium culture from either an abscess or nasal discharge. So once again, this disease will result in enlarged lymph nodes that may abscess. It can also cause abscesses within the guttural pouches that will result in nasal discharge when these abscesses rupture. And the nasal discharge can either be unilateral or bilateral. It is typically very purulent, very thick and creamy, and contains tons of bacteria that can easily be identified by culture. Generally, it is recommended to let horses go over the course of the disease so that they can build up their immunity and spontaneously get rid of the infection. In severe cases where horses become severely depressed, dysphagic because of the size of the large lymph nodes in their throat area, or anorexic, it is sometimes recommended to treat this disease, and most commonly recommended treatment will be penicillin and non-steroidal anti-inflammatories, also to control the fever that is very commonly associated with this disease. By looking at the neck, there's different things that you look at. First of all, the muscular masses, and we talked about muscle atrophy earlier in the course of this talk. And the muscle masses on the neck, just like anywhere else in the body, need to be symmetrical. Also, some local trauma can result in changes in muscles and muscle fibrosis, but not very commonly, however. The jugular veins are the veins that are most commonly used for intravenous injections in horses, and poor technique or injection of irritant products outside of the vein can result in jugular phlebitis. So in this case, you see a very severe case that was associated with a catheter in this horse, and the side of the catheter became infected. So it's really important to monitor jugular catheters very closely, because the result of this phlebitis may be a complete thrombosis of the vein that may result in chronic pain and chronic distension of the veins of the face. The potential for catheter problems is increased when you deal with disease status that involve a hypercoagulable state, such as endotoxemia or DIC, disseminated intravascular coagulation. And these diseases, once again, will be metritis, colitis, anything that is associated with gram-negative bacteria. Moving on to the thorax. Thoracic auscultation is better performed in a very quiet room, and in order to increase inhalation of air, you may use a bag placed over the horse's nose to try to force the horse to take deeper inhalations. Bacterial pneumonia are one of the diseases that may be observed by the presence of abnormal sounds, lung sounds, and you can listen to horses' lungs and hear crackles and wheezes that reflect the obstruction of the smaller airways within the lungs. So as we mentioned before, bacterial pneumonia in adult horses is most commonly associated with pleuritis and with a history of long-distance shipping. Very commonly, the particles that are inhaled during this process contain anaerobic bacteria, and this infection with anaerobic bacteria can actually be detected by culture, obviously, of the transtracheal wash, or since we're dealing with the pleuritis, you can also collect some of the pleural fluid that is infected and contains some of these bacteria by thoracocentesis. But sometimes the infection is so significant that the odor of the airflow can be an indication that there's an anaerobic infection going on deep down. The best diagnostic tool that we have, as I said, to identify the presence of bacterial pleural pneumonia in adult horses is thoracic ultrasound. And as you see on this picture, there is a segment of the lower, tip of the lung lobe that is completely collapsed, where it looks almost like liver tissue. And the darkness around that triangular area of collapsed lung reflects the presence of large amounts of fluid in the chest. So this disease is a very serious disease, and very often horses, despite aggressive treatment, will not come out of this problem. So it is something that needs to be checked for and tried to be prevented by reducing the stress associated with shipping and try to reduce the length of the transport of these horses. In foals, once again, Rhodococcus equi is the most common cause of bacterial pneumonia, and it results in multiple abscesses. These foals will present, they're very commonly at weanling ages, and so 3 to 4 months, 4 to 6 months rather, and they will present with severe respiratory sounds like rattles, and they will very commonly have a very abundant bilateral purulent discharge. They have an extremely elevated heart rate and respiratory rate. And on some farms, you will see that this problem is endemic, and the presence of bacterium that carry the virulent factor. This is a factor that is actually carried on a plasmid within the bacterium. Rhodococcus equi is a very common organism in the soil everywhere. Where it causes diseases in horses, researchers have identified this particular plasmid that carries an infectious that carries a factor that causes the disease, basically. The foals on these farms will very commonly become sick around 3 to 4 months of age, and year after year, this is observed in every foal crop. A way to try to decrease the incidence of disease in these foals is to administer hyperimmune plasma as soon as they're born. Another cause of bacterial pneumonia in foals will be a streptococcus. It's a Streptococcus zooepidemicus, and this is more an opportunistic organism in neonates. Another common disease of the lungs in horses is COPD, or chronic obstructive pulmonary disease. It is also called HEAVS. This disease is very commonly observed in older horses or middle-aged horses. They're most of the time over 5 years of age, and these horses are generally stabled in an environment where there's a lot of dust. It is a allergic type of disease, so it's a non-infectious type of disease. So these horses will not have any fever or changes in the blood work associated with it. But this is a disease that can nevertheless be very detrimental, especially when it's associated with exercise intolerance. Over time, this disease can cause structural changes in the lungs. And as I said, it is an allergic response to airborne allergens, and most of the time these allergens are found in the hay dust. The disease results in the thickening of the small airways and of the little bronchioles in particular, and also the plugging of these bronchioles. So the air, basically, when horses inhale, the air gets trapped behind these bronchioles that are affected because of small mucus plugs, and therefore these horses exhibit a very severe expiratory effort, which can long-term result in the presence of a heave line, where the respiration, the breathing pattern has acquired an abdominal component. So the heave line is basically due to the fact that these horses are constantly trying to push air out of their lungs as hard as they can using their abdominal muscles. Auscultation of the thorax also involves cardiac auscultation, and some of the most common defects that will affect the horse's hearts can be either congenital or acquired. The most common congenital defect is ventricular septal defect, which results in a murmur that will be pansystolic, so cover the whole systole, and be band-shaped. This murmur will be loudest over the third intercostal space, and will be, in most cases, loudest at the base of the heart. In foals where the ventricular septal defect is less than 2.5 centimeters in length, the prognosis is potentially not too bad. These foals can turn into useful horses, and this defect, even though it will cause a murmur for the rest of the horse's life, will not affect their performance. If you deal with larger defects, this is obviously a condition that will be potentially fatal and in long term, but will result in a potentially not useful animal. Acquired conditions that affect the valves in horses can affect the mitral valve, and in cases of bacterial endocarditis, the valves can become deformed to the point where they become incompetent. So clinical signs associated with mitral regurgitation, which is one of the most common valvular problem that horses acquire throughout their life, will be poor performance, cough. In the case where the infection that caused the initial endocarditis is not controlled, these horses may still exhibit fever. And the murmur that will be auscultated will be holosystolic and will be loudest over the fifth intercostal space on the left side. Tricuspid regurgitation can also be observed in horses and will result in some cases in decompensation to the point where you see signs, as in this picture, of congestive heart failure. This horse was presented for poor performance and cough and turned out to have a very severe edema present over its legs and ventrum and below its thorax, which are signs of congestive heart failure. In case of tricuspid regurgitation, the murmur will once again be holosystolic, so cover the whole systole, and will be more obvious on the right side over the cardiac apex. In the case of tricuspid regurgitation, we can actually see evidence of tricuspid regurgitation consecutive to pulmonary hypertension, which is in itself consecutive to mitral regurgitation. So the first event may actually be the mitral regurgitation that will long-term cause the tricuspid regurgitation. Aortic insufficiency is most commonly observed in older horses, and most of the time this will be an incidental finding where it's not associated with any clinical sign in particular, but in the case where it is associated with exercise intolerance or signs of congestive heart failure, the prognosis is more guarded. The murmur that will be auscultated in the case of aortic insufficiency will be holodiastolic, and it's generally a decrescendo murmur that will be more obvious around the fourth intercostal space over the aortic valve. These horses can also, if they become clinical, they can also exhibit a bounding pulse or as I said, signs of congestive heart failure. Arrhythmias that are observed in horses are fairly common and include second-degree arteriovenous block, auriculoventricular block, So this arrhythmia is the most common type of arrhythmia observed in horses, and it is due basically to an excessive vagal tone that is due to the very large size of the horse's heart. This is something that usually disappears with exercise and is an incidental finding. Basically, what you will notice is when you auscultate these horses, they have a usually very slow heart rate, and they will skip a beat on auscultation. And you can also palpate a deficit in the arterial pulse associated with it. Most of the time, as I said, this is an incidental finding that will not result in any kind of disturbance for the horse's use. However, in 20% of the horses, there will be an underlying cause for this defect, which will be associated with cardiac disease, and in that case, it could have an influence on the horse's performance. Atrial fibrillation. This is a fairly common disease that we see in equine athletes. Whenever you see an equine athlete with a disturbance of the cardiac rhythm, in most cases it will be caused by atrial fibrillation, and this is a diagnosis, by the way, that is made by ECG. In some cases, this can be associated with exercise intolerance or exercise-induced pulmonary hemorrhage, myopathy, dyspnea. These horses can become ataxic or collapse at the end of exercise. Once the condition is diagnosed, it should be treated promptly, because the longer you wait, the longer the more chances you have to have problems to treat it. But the initial cause of this arrhythmia is believed to be a premature depolarization of the atria that is caused by re-entry. So therefore, what we treat these horses with is quinidine, which basically increases the refractory period of the atrial myocardium, and therefore prevents re-entry. And once again, the treatment should be installed as soon as the condition is diagnosed, because it helps to increase the prognosis. Another condition that can affect horses is ionophore toxicity. And ionophores are used as supplements in cattle feed. So when you're dealing with a mill that processes cattle feed as well as horses feed, in some cases spillage can occur where the horses feed is contaminated with ionophores that are used for cattle. And horses are particularly susceptible to ionophores, which can cause various clinical signs, including diarrhea, colic, sweating, ataxia, and overall weakness. But these signs can also be related to cardiac disease, because this toxin affects the myocardium very specifically. And the clinical signs that you will see will be arrhythmia and defects in arterial pulse. The cases where horses survive can actually long-term keep signs of cardiac dysfunction and become cases of heart failure. And in most cases, though, the clinical signs occur fairly shortly after the ingestion of the contaminated feed, most of the time within 12 hours. And these horses end up being euthanized or die pretty rapidly thereafter. And on necropsy, the discoloration of the heart is fairly evident, where there's areas of really pale myocardium that are caused by the presence of that toxin. Evaluation of the abdomen and abdominal disease, as I mentioned earlier, a very common occurrence in horses is colic. Basically, in equine practice, this will be one of the diseases that you will treat most commonly. So, as I mentioned earlier, also colic is most of the time due to dysfunction of the intestinal tract. The workup of a colic includes a physical examination to try to determine whether this horse needs to be treated medically or surgically. Nasogastric intubation will allow you to detect the presence of buildup of fluid within the stomach. Rectal palpation may help you to determine whether organs are in place or whether they're distended by the presence of feed or gas or fluid. Abdominal paracentesis will allow you to collect some fluid that is bathing the abdominal organs, the peritoneal fluid, and changes in this fluid will actually reflect changes within the intestinal tract. Other mediums or other types of diagnostics that we perform on horses with colic include ultrasound. Radiographs will be performed in foals because in adults the size of the abdomen precludes the use of useful radiographs, except for the presence of aneurolith or stones that form within the intestinal lumen. Gastroscopy will be used to try to determine the presence of gastric ulcers, which may also result in colic. So the two different types of colic relate to the type of management that you can implement. The first one will be medical treatment of colic, and the colics that are treated medically include impactions, ulcers, gas colic in some cases where it's not too bad and the horses are not too painful, or proximal enteritis, which will result in the accumulation of large amount of fluid in the proximal small intestine, which will then result in severe distension of the stomach, and the stomach needs to be evacuated on a regular basis by nasogastric intubation. Medical management consists in fluid therapy, analgesics, and very close monitoring, because some of these diseases may turn out to necessitate surgical intervention, which then needs to be done in a timely fashion. So surgical colic will be a colic caused by displacement of segments of intestine. Torsion, very commonly the large colon torsion, results in very violent signs of colic and is truly a surgical emergency. Infarction, so areas of intestine that become devitalized because of the presence of blood clots or torsion of the vessels need to be resected, and intussusception also need to be surgically corrected. Diarrhea is also a common disease that can affect the intestinal tract. In adults, we're most commonly dealing with organisms such as Salmonella, Ehrlichia rhistisi, which is the agent responsible for Potomac horse fever, and Clostridium perfringens. In foals, we can also have diarrhea caused at time of foal heat in the mare, so about a week to 10 days after the foal is born, and the etiology of foal heat diarrhea is not very well known. It's generally a benign diarrhea, transient, just lasts a few days, and self-controlled, and foals don't really get sick. Parasites can also cause diarrhea in foals. E. coli, Clostridium perfringens, rotavirus, which is a virus that affects the tip of the villi that can cause foals to have a fairly severe diarrhea, and salmonellosis, which may also be associated with septicemia. When we look at the abdomen, we also have to consider diseases of the urinary tract, which are not that common in horses, but when they do occur, most commonly what we see is signs of cystitis or pyelonephritis, which very commonly is secondary to urinary stasis or bladder injury. Acute renal failure will occur consecutively to the ingestion of a toxic or the accumulation of drugs within the system, such as aminoglycosides, antibiotics such as gentamicin. Non-steroidal anti-inflammatory drugs can long-term cause pyelonephritis. Blister beetle, which is a beetle that secretes a toxin called cantharidin, which is found in alfalfa hay and cause acute renal toxicity. Myoglobin, which is released in large amounts in horses subject to myopathy. Other causes of acute renal failure will be hemodynamic, so horses that have profound cardiovascular shock will shut down their kidneys, basically, and this can cause long-term disturbances. Chronic renal failure is observed more so in older horses, and generally the first complaint is weight loss, and most of the time this is associated with chronic glomerulonephritis, which can be autoimmune in origin and will result in high creatinine levels and evidence of chronic renal failure. Now, when we look at horses' gait, and obviously this will be addressed also by in the surgery lecture, which will look at problems of lameness. From an internal medicine standpoint, when you look at the gait, you will mainly be looking for signs of ataxia. And ataxia should not be confused with weakness or stiffness. It is most of the time associated with a proprioceptive deficit, and some of the diseases that will cause ataxia have been addressed earlier in the course of this lecture, but in most of the cases where we will be dealing with equine protozoal myeloencephalitis, Wobbler syndrome, one of the viral encephalitides, EDM, or trauma. The gait can also be stiff, just because of a general condition such as degenerative joint disease and arthritis, and this is a disease of older horses, obviously. Another reason for a stiff gait will be a primary affection of the muscles, and rhabdomyolysis is a fairly common disease in equine athletes. In particular, young racehorses in training that are subject to a lot of stress can exhibit signs of chronic myopathy with stiff gait observed either right after the exercise or a day or so after. And the way we diagnose that is through clinical signs and also elevation of muscle enzymes within the serum. This disease needs to be treated aggressively because the release of myoglobin from damaged muscle fibers can result in renal failure, as I said. So the treatment will involve fluid therapy that should be fairly aggressive. Polysaccharide storage myopathy is a disease that will result in accumulation of abnormal glycogen within the muscle fibers and can result in episodes of rhabdomyolysis that are fairly common. The treatment for this disease is a change in the diet where you reduce the accumulation of glycogen in the diet and replace it by fat as a source of energy. White muscle disease, which is observed in foals, is the result of a deficit in vitamin E and selenium in mares and can be fairly well treated with the administration of vitamin E and selenium. And finally, I would like to address some of the most common diseases that we see in newborn foals. One of them being the failure of passive transfer. As you know, foals rely strictly on the ingestion of colostrum to obtain antibodies against most common pathogens that they will be exposed to. Therefore, if they fail to ingest enough colostrum, or if the colostrum is of poor quality, or, for instance, if the mare has lost a lot of colostrum prior to give birth through permanent leakage from the udder, this deficit may lead to septicemia, and in most cases, the septicemia will become fatal. Septicemia is a very common problem in foals, and as a rule, you should consider that any weak foal is a septicemic foal until proven otherwise. So this is a disease that will be diagnosed with blood culture, and also this blood culture will help you to determine what the appropriate course of antibiotic will be. Septicemia can potentially affect all the body systems and result in multiple organ dysfunction. A very important differential diagnosis for septicemia, because the first sign of septicemia will be a weak foal, generally less than a week of age. So another common cause for weakness in neonates will be neonatal maladjustment syndrome, also called dummy foal syndrome, which is a result of a lack of oxygen either towards the end of gestation due to placental insufficiency, or during the birth process, which should not take more than half an hour, and in some cases where it takes longer, foals are deprived of oxygen for a fairly long period of time, which will most commonly affect the brain primarily. So these foals can be born fairly normal and then gradually become weaker and weaker. So therefore, whenever a foal is presented weak, this is a very important differential between septicemia and neonatal maladjustment syndrome. Also because the outcome will be very different. The prognosis is much worse in the case of septicemia, and foals usually need to be treated very aggressively for septicemia, whereas the treatment for neonatal maladjustment syndrome will be primarily supportive. Foals that are a few days old that colic very often have an obstruction of the terminal part of the intestine by meconium. Meconium is the first feces, and meconium is much harder than the regular foal feces, so therefore we can observe a little bit of constipation there. So this is not unusual. This is the most common cause of colic in foals, and is usually treated medically. Neonatal isoerythrolysis is a disease that causes foals' red blood cells to be attacked by the antibodies contained in the colostrum, and this is inherent to the mare. Most of the time, these are mares that have had several foals in the past, and this is caused by the fact that they have a blood type that is different than the stallion's blood type, and if the foal inherits the blood type from the stallion, the mare has formed antibodies against these blood types that are passed on to the foal when the foal ingests the colostrum. These antibodies will end up lysing the red blood cells and cause a profound anemia and very often severe icterus in these foals. They usually show signs of weakness and anemia within the first few hours after birth. Another common event in newborn foals is a rupture of the bladder, which can be traumatic and due to the forces exerted on the foal's abdomen during by the time they're expelled out of the mare's pelvis. The contraction from the abdominal contraction of the mares and the uterine contraction of the mare can actually compress the foal's abdomen to the point where a full bladder can literally explode. And these foals will exhibit a slow onset of weakness and abdominal distension. In some cases, colic, but this is something that needs to be addressed fairly rapidly. Once again, the best way to diagnose this disease is through abdominal ultrasound, which will reveal the presence of large amounts of fluid, free fluid in the abdomen, and collection of that fluid will reveal a high creatinine, which is consistent with urine. And this is a problem that needs to be corrected surgically. And this is it for this lecture. I hope that this will give you an insight in some of the most common problems that we see in horses. It obviously cannot replace all the years and experience that is necessary to become more familiar with equine internal medicine, but these problems that I just addressed in this lecture should give you a good base to prepare for the test. Thank you.